Today I'm going to talk about exercises that you can do to treat your finger stiffness. If you have trouble either extending your fingers fully or closing your fingers fully, then I found these exercises just for you. After looking through a couple of different therapists' recommendations, almost all of them recommend some type of range of motion exercises for these 4 different joints: our MP joints, PIP joints, DIP joints, and wrist joints. The most popular finger range of motion exercise is probably the Tendon Glide. It's a series of finger movements that targets different joints in the hand. It's straight hand, 90 degrees at the knuckles, into 90 degrees at the knuckles and the PIPs, into a hook fist, 90 degrees at the PIPs and DIPs, and into a full fist. There's 90 degrees here, here, and here. Here, 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 and here. It doesn't have to be the same every single time. As long as you are able to practice all of them, you can practice them individually, repetitively. This is a very good strengthening exercises for the flexor tendons. And I like this exercise because you can progress or strengthen the benefits of this exercise by adding resistance pretty easily. You can use a therapy putty and just put it over here, and you can do the strengthening exercises like this. The next exercise is a blocking exercise that was recommended by Virtual Hand Care. This is especially useful for targeting the PIP joint and the DIP joint. To target the PIP joint, you will block right over here. I will block right below the PIP joint, and I'll try to flex. If I want to target the DIP joint, I'll just go right here. This is the active flexion of these joints. Overlay your fingers like so. Flex your fingers like this. You are supposed to be able to target different segments of your fingers. What you're really doing is you're blocking 4 of the fingers all at once. So this is essentially the same as this, but you're doing multiple fingers at the same time. Another very good exercise that you can do is just general finger distraction. Hybrid calisthenics recommended that you just do gentle pulling like this, almost like massaging almost. You're starting off quite gentle, like a gentle massage, and you can slowly increase the force that you're pulling. You can do that for each finger. You can do this a little bit more aggressively. Dr. Rowe shows in one of his videos how to do this. Suppose that you're going to stretch this finger. You would take your other hand like so, and you can pull like so. And you can also target the knuckle here by going a little bit higher. And you can do that. So this is a good stretch for the joint. It's very safe as it creates space in the joint. Dr. Rowe did mention that if you can tolerate it, you can do a little bit of turning, like a very gentle turning like this. This could be quite uncomfortable if you have any strain of the ligaments along the sides of your finger. If you don't have that sensitivity and you just have a lot of stiffness, this might work very well for you. A very popular exercise is just general flexion of the fingers, pretty much making a fist and opening your fingers, making a fist, extend the fingers. Another one that is a little bit similar but kind of different is finger touches. The thumb to index finger covers the shortest distance, so this will be the easiest. The middle finger will be a little bit farther, ring finger a little more distance, pinky the most distance as travel between the 2 fingers. So that will be a little bit more difficult if you have a lot of thumb stiffness. This is an excellent exercise. It's very functional because we do this all the time when we have to pick things up. Also, when we use a pen, when we use utensils. Another exercise that's also good and recommended by Dr. Joe from Ask Dr. Joe is the finger abduction and adduction. It gives you a good stretch of your finger adductors here between the fingers. Another exercise you can do to relieve some finger stiffness is moving the wrist joint. Actually, Dr. Joe also recommended that you do a bit of a wrist range of motion and wrist stretching. The reason for this is because all of your finger tendons connect to the wrist all the way down here. So your finger flexors connect to the common wrist flexor here. Your finger extensor connect to the common wrist extensor here. It makes sense that if there's tension in the fingers, it will carry over to the wrist. A lot of the times, my patients who have finger stiffness also have wrist stiffness. So it makes sense to work both, and they will carry over to one another. Something that I don't really see any of the YouTube channels recommend, but I personally do quite a bit for my patients, is I ask my patients to arrange each joint of the fingers passively if they have a lot of stiffness. And I do this for them in the clinic. It's called passive range of motion. Basically, I move their fingers for them, basically loosening it up manually. So I ask them to do it for themselves. And all you do is you take your uninvolved hand and you hold involved finger, and then you just gently move it back and forth. And you can do both flexion, extension. I also like to block in the passive range of motion as well. To do this is better if you lay your hand on a supporting surface like a table, and then you bring your finger into this range of motion, or like so, assuming this is supported. So these are all the exercises that will help with decreasing tension in your hand, your wrist, your fingers. I'm working on a video that's going to show you different ways you can strengthen your fingers. I hope that you'll also look forward to it.